Hello, Queen City Skin podcast listeners. Welcome back. Today, I am going to take the opportunity to talk to you about things that I do for my skin. So I was at our new Huntersville office yesterday. We have put some lasers up there. Finish up my day. We're just not quite as busy there. It's only the second week of it being open at this stage, so we're open for appointments. So I took the opportunity to do some of the things that I love to do for my skin and share them with you because you can see it on my skin. This is day one after having these treatments done. Welcome to Queen City Skin, the podcast where skincare meets science and confidence is always in style. I'm Dr. Elizabeth Rostan, board-certified dermatologist and founder of Charlotte Skin and Laser.
And I'm Dr. Emily McLean, a board-certified medical dermatologist at Charlotte Skin and Laser. We're here to cut through the noise, from social media myths to marketing hype, and bring you clear, evidence-based advice on caring for your skin at every stage of life.
Whether you're looking for everyday skincare essentials, the truth behind trending treatments, or lifestyle tips to age gracefully, you'll find it here.
Because healthy, beautiful skin isn't about perfection. It's about feeling confident and healthy.
Let's get started. So we can start by me telling you why I do them. My goal for my skin is to keep it as youthful and healthy as I can as I age. So I've been doing these things for a while. This is obviously my business, is helping people maintain youthful, glowing, beautiful skin. It's also associated with healthy skin, and I like that. When I was younger, I tanned a lot. I was we spent all day outdoors, constantly. And I have this olive skin that tanned, and so sunscreen just really didn't exist for us. And I ran around like a little brown berry. We posted on Instagram that picture of my friends and I playing Monopoly on a boat dock. So we're just out there all day long. But that leads to sun damage, wrinkles, breakdown of collagen, and elastin. My sun tanning days were over in medical school when I started looking at skin cancers under the microscope, and it's really incredible the change that occurs from sun damage. I understand that change. I try to share it with my patients and you, and I try to prevent it. So through the years, I try to maintain some facials. Those are nice, and they exfoliate the upper layer of skin. I'm prone to clogged pores and acne, so I might get a hydrofacial or a glow 2, followed by a peel. Get those pores cleaned out. It really helps me. I will do a vascular laser. That seems to be under control. I don't do that very much. What's a vascular laser? That's a laser or device that treats blood vessels and redness in the skin. So over the years, I've had the V-beam pulse dye laser, a real workhorse. I have had IPL, and IPL, and listeners, that can be the same as BBL. It is broadband light. Okay, IPL is intense pulse light, same thing. It's just broadband light, not a laser. And you use cutoff filters to focus the beam between certain areas. But it can get reds and browns. Some of the wavelengths go deeper for skin rejuvenation. It's awesome. I mean, it came into existence around 1995 or 6, and we still use it a lot. So while we try to stay on the cutting edge and offer our listeners and our patients the latest and greatest information and technology, there are still some old workhorses that just do wonders for the skin. And IPL has been shown to activate some anti-aging genes, and I think that's why it has stood the test of time. Probably 10 years ago, there was a study that came out of some patients. It wasn't a big number of patients, 15 or 20, but they had had IPL treatments yearly for 10 years. And they had photos from before and then 10 years later, showed those photos to what's called blinded observers. They don't know which photo is which, and asked the observer which photo looks better. And over 90% of the time, the observers chose the 10-year older picture as looking better. And I think that's a testament to what these devices can do to rejuvenate, renew replenish the skin. This is regenerative medicine renewal. The other thing I commonly do is sometimes I'll do a pigment laser to burn off freckles. That doesn't seem to be an issue any longer. And a fractional laser. So our non-ablative fractional is just a workhorse for us. This is what came out in 2003 as Fraxel, Fraxel, in a 1550 wavelength. Okay, that penetrates more deeply. Subsequent to that, maybe in 2006 or 7, a 1927 wavelength came out that's more superficial, does not go as deep into the skin. So less painful, really gets superficial color, really helps tone, find wrinkles. Patients come in for consult, and I'm like, oh, you need a 1927. And that's what I'm referring to, the non-ablative fractional. The non-ablative means there's no ablation. So there's no open wounding of the skin. So if you look at my skin now, I did have a 1927 yesterday, an aggressive one at high energy. And you can see some of the impacts. There's no oozing or draining. We also offer an ablative fractional laser that's highly customizable. So you can kind of do the same thing with a little more show of the impacts of the laser. And that's called ultra clear. Today, we're talking about the treatments that I commonly get done. And the reason why is I had 2 of my favorite treatments done yesterday. I was at our new Huntersville office. We are finishing up our 2nd week of being open, and we have put some of our favorite lasers up there. And we're not that busy. We are booking appointments as we build up. So if you feel like you need a dermatology appointment or a cosmetic appointment, we can fulfill your needs there. Currently 3 days a week until we grow more. One of the lasers we have up there is the Ultralaze MD, a 1927 fractional. And we also have my favorite radiofrequency microneedling, which is the Lutronic Genius device. Those are the 2 treatments I had yesterday. So I took the opportunity to put some local numbing on the topical numbing. Anyone that's listening that's had a treatment like this, they know that they come in early, you get your photos taken, and the topical numbing goes on for about an hour. Then it's cleaned off, and the first treatment I had was the radiofrequency microneedling. This is the Lutronic Genius device. This is supposed to tighten the skin, but the tightening the skin is really not this deep structural tightening. You need something different from that or a facelift. This is restoration of skin collagen and skin elasticity, and additionally little micro deposits of heat that give you some skin tightening. So this restores the resiliency of your skin, the crepiness, this kind of neck thing. So I had my face and neck treated. I would say maybe 18 months ago, thought my neck looked rather dismal. I just don't have a good jawline structure, so it doesn't hold up the neck skin very well. And I had, I think you can even see it now, some crepey skin. Sort of the phone neck. I think the phone neck is, the tech neck is kind of looking down. You get the deep lines. But as you get older, you also see the skin fall. And when it falls, it often looks like a little curtain draping, and that's kind of what I was getting there. Why does that happen? Well, there's changes from loss of volume in the face and changing bony structure, but loss of elasticity in the skin. So as I describe it, you reach in your drawer to pull out a rubber band to wrap up the potato chips you didn't finish or whatever. But you stretch it, and that rubber band doesn't bounce back. It's been in there too long. It has lost its elasticity. That's like our skin. It just lost the bounce back. So if you kind of do a snapback test on your neck skin and you pinch and pull and it stays there, you've lost the elasticity, and that can lead to some sagging skin. I think this microneedling radiofrequency is an excellent way to restore that. We have many other devices. I just took the opportunity to utilize this device. It also creates little channels in the skin through which you can put topical agents to assist in the process. With radiofrequency microneedling yesterday, I did have her do my forehead, and we'll see how that turns out. I think that's the first time I've treated my forehead. Again, trying to get a little lift and restoration of tightening. And Lauren and I took the liberty of trying to treat around the eyes. You can't treat over the eye, but you can pull the skin up. So she treated some of my upper eyelid and lower eyelid. We all know that the eye area is very troubling as it gets more loose and crepey skin. And then after that, I had Lauren do a fractional 1927 laser. That's the Ultralaser MD on top of it. And anyone can do this. It's very easy. We don't always layer them. I think people kind of get tired of the procedures, but they are two different technologies, and you can harness the best of both technologies. With the radiofrequency microneedling, just to describe, it's a little mechanical group of needles that goes into the skin at different depths. So we go to the machine, we say we're going to go 2 millimeters deep or 1.5 millimeters deep. And then you set the energy, and the tips of the needles deliver that energy. And it's just you march along the face getting that energy. Then in a second pass, you put in another level, say 1.5 or 1, and the energy. So you get deposition of little microscopic wounds and heat delivery in the skin, but down deep in the skin. That's great. And you get that deep renewal. For people that have a lot of sun damage, I think it can induce a little bit of turnover of the bad collagen and elastin too. Then, if you go over the top with the non-ablative fractional, the 1927 Ultralaser, that's kind of a skin polisher, a skin buffer, lifting up superficial sun damage, brown spots, discolorations you don't like. It treats fine lines and wrinkles. It restores superficial collagen in the skin. For anyone who's had that knows what a shine and a glow they can have after it. This is the laser that, honestly, if I'm disappointed with how my skin is looking, I'll run down here, turn it on, and treat myself. It's not painful, particularly at low energies. I think they are calling that the glow. So if you don't want to fuss with coming in for topical numbing, which is how I normally do it, I just don't use the numbing. But with the radiofrequency microneedling, you really need it. So I took the liberty of having a higher energy 1927 yesterday. So I think today I look more red than typical. If I just get a radiofrequency microneedling or just a lower 1927 Ultralaser, you really don't see much of anything. We also took the liberty to really get around my eye, and I couldn't find my little eye roller, so you can kind of see it around my eye. But I have zero tinted sunscreen on. I say makeup, but it's really tinted sunscreen that I wear. I will put it on later, and we can see what it looks like in real life. I went out to dinner last night, and no one knew. So these are nice, very approachable, very doable treatments. If an area is painful or gets hot, we've got the Zimmer cooler. It's essentially an air conditioning through a tube, and you can blow it where it's hot. So I use that at the end. But there's something else you can do with these treatments. Like I said, you can use them to get topical treatments in better. One of the topical agents that we're using and we're very excited about is the Pro-Exo exosomes. We have a serum in the office. It's highly concentrated exosomes in a vial. I think it's like 80,000 or something in the vial. So if we use a whole vial on your face and neck, you're getting a high concentration of exosomes. Maybe I should explain what an exosome is? Right, yeah. So exosomes are intracellular signaling packages. They're tiny. They're little bitty. We talk about peptides and growth factors. They're just tiny little particles, and they contain signaling molecules. They contain growth factors and some peptides, and they are like, we describe it in our office as the UPS guy coming to my office. And any patient that's been here when he's arrived probably is wondering, good golly, what all do they buy? And he comes in with his cart with 12 packages. These exosomes is like the UPS delivering rejuvenating packages to your skin. They are released in the skin, and they stimulate renewal, regrowth. This is true regenerative medicine. Now, I said they come in a vial and that you can do a treatment, and we can put it on your skin. You can do a microneedling treatment. You can do a 1927 fractional treatment. You can do a Tixel. You can do our special treatment called Juvasonic, which causes a little bit of cavitation. All of that drives the exosomes in the skin, but I cannot inject them. This is not FDA approved for injection. So we can use them topically. We've seen some great results. I like using them topically because I want to maximize my results from these energy and laser devices. I'm doing this to renew my collagen, renew my elastin, and help restore the resiliency, youthful glow of my skin. At Huntersville yesterday, we did not have those exosomes, so we used a new product that's also exciting called VAMP. VAMP is also a liquid. It's not quite a serum. It's a little gel-like liquid that's put on immediately after the treatment. It contains amino acids and vitamins, and this is kind of considered a treatment booster, right? So if you want to get your best out of your workout program, you're going to watch your vitamins and even your amino acids, get your protein. But these are necessary for your skin cells to function, to grow, to renew. They need this too. And it also has ribodeoxynucleic acid in it, which is the thing that comes from salmon sperm. Okay? These are not well tested, but we are experimenting with this new VAMP. They can be used with the exosomes because they're different. The exosomes do not have deoxyribonucleic acid in it. Okay? The controversy over deoxyribonucleic acid is there's not been any formulated standard way of isolating these deoxyribonucleic acids. This is from a reputable company, one that we use other products from, so I have some trust in them. We're going to start using it. You can ask for it, and we'll just see how it goes in terms of rejuvenation. So that was put on my skin after. So again, laser treatments, they can rejuvenate your skin, create new collagen, restore elasticity, remove sun damage, treat fine lines, wrinkles, everything looks smoother, a nice glow. But immediately after these treatments, we've got an opportunity. Skincare products get in better. Okay? Your skin is a barrier. It's a wall. So a lot of the products we put in, they don't get in very well. And I certainly can't rub a very expensive serum on your skin and expect that it's going to get in. We need to drive it in. These devices, basically they increase the permeability of your skin. They break down the barrier temporarily and just enough for us to get these products in. Exciting. The other reason I do this treatment, kind of in the back of my mind, is for reduced risk of skin cancer. And there's a growing body of evidence that the fractional ablative laser and the fractional non-ablative laser and the vascular laser I was talking about, we have DermaV, V-beam, IPL, the blood vessel laser. These all reduce your risk of skin cancer and precancer. The 1927 is actually used to treat precancers. Those are those actinic keratoses that are frozen off when you come in the office. They are a sign of sun damage. They are a sign of an increased risk of skin cancer. So amazingly, the stuff is so good, we are recommending this to older gentlemen that come in our clinic for skin cancer checks. If they have a lot of precancers and we feel like we're losing the battle, this is one of the tools that we can use for that. So true rejuvenation and regeneration. We are making the skin healthier, both from a structural standpoint. We know that after these treatments, the structure of your skin, like the mattress pad, the extracellular matrix that holds everything together, is better. The upper layer of skin becomes healthier. It has a better, what we call a reedy ridge pattern. It's stronger, it's more resilient, it's less prone to bruising. The upper layer of skin becomes healthier, it's smoother, it's not dull, it doesn't have that dead layer on it. But we're learning we make it healthier on a cellular level. And we'll talk about this more in another podcast because I'm really enthusiastic about it. But the rejuvenation of the fibroblast seems to also keep the functional properties of your skin working better. And one of those properties, one of roles of this fibroblast is to fight off precancerous cells, to signal, hey, get rid of this cell, it's a bad cell. And as that cell gets older and it's not doing its job, it doesn't do that. Well, we wake it up and make it start doing its job. So those are some of the things that we do for skin rejuvenation. Downtime is minimal with what we do. You can see, if you go online or our YouTube channel, you can see what I look at. We'll do a close-up. I do look more red than I typically do because we did higher energy settings yesterday on purpose, just took the opportunity. But once I put on tinted sunblock, most people won't notice unless they look really close. I can feel like a sandpapery texture on my skin. There's some little pinpoint, they're called kind of petechiae. That's where the needles went in, easily covered. A little edema and swelling under my eye from treating the eye area. But I would say if you do this treatment with the fractional laser, do get under there. It's a great treatment for that. All these signs will fade over the next 48 to 72 hours. And then that sandpaper refill, that kind of hangs on a little bit and then slowly sloughs off by day 5 to 7. And this is not a peel, like peeling you see. It's just something you notice. You're like, oh, it feels better after I wash my face. So very straightforward, easy. I won't say pain-free, but it's no big deal with the cold air and the topical numbing and easy to heal up from. So I encourage you to explore ways that you can rejuvenate your skin to make it more beautiful, more healthy, and more robust. These treatments also pair well with a good home regimen that we can talk about in another episode. You've heard it before, but using the power of skincare in conjunction with these devices to help achieve the maximal result. So I hope you've enjoyed sharing what I do. I guess I'm not being totally honest, because if we're having an episode about what I do, we need to talk about the other stuff too. We were just talking about the laser because my face looks like this. Of course, I do neuromuscular relaxer, as we call it, relaxer here. Those are things like the Botox, Dysport, Xeomin, Jeuveau, Latibo, that we use to relax lines of muscle movement. So in here, but it also can lift the brow, crow's feet, do chin, neck bands. A growing segment of the population is getting it in their jaw muscle, the masseter, because they grind their teeth. So yes, Dr. Rostan, of course, does the relaxer, and she's very grateful for it. So grateful. Filler. I don't do a lot of filler. I have in the past, and it just seems to be lasting me. I recently had a little hyaluronic acid filler. Kristen did a great job, but she could hardly find anywhere to put it for me, just because I have a narrow face and we don't want to create an abnormal contour. Here at Charlotte Skin and Laser, we focus on beautiful natural results and helping you look the way you're supposed to be, only better, not looking something different. So we did some biostimulatory filler with polyl-lactic acid or Sculptra, and that helps in the renewal process. We did that in my lower face. We may have done a little bit in the neck. This is another tool I commonly use to help my patients achieve more youthful, resilient, rejuvenated skin, because it does, similar to the laser, wakes up those fibroblasts to start making you collagen and elastin. So I do that. And then if I were to go over my skincare routine, we'd be here another hour. But I do rotate them in and out, the peptides and the growth factors, but I use them all, and I have the basic anti-aging. I was on a panel at the Global Aesthetics Conference, and it was what's on your bathroom shelf. It was a bunch of women and on the panel, and I just decided the only thing I can do is focus on peptides. So I talked about the peptides I use, but it was a 5 o'clock session. I thought, no one's going to be here. It's Miami Beach. Don't you want to get ready for dinner or walk on the beach? No, the place was packed, and the number of men in the audience, these are men physicians, furiously documenting what we use. A real interest, and we understand and appreciate the value of combining good skincare with both non-surgical and surgical treatments. These were surgeons writing all this down. When they do a facelift, they don't want to turn you loose. They want you to have great-looking skin. So for Dr. Rostan, it's energy, and laser treatments, relaxer, biostimulatory filler, touch of hyaluronic acid filler, and a boatload of skincare products. And of course, big giant hat and sun protective clothing. Anyone who's hung out with me knows that. I appreciate your attention. I welcome comments and questions. I'll answer, most of them about what I do, I guess. And if you have any burning, itching questions about your skincare routine, happy to address them. Many people sit back with fear about doing a laser treatment. Don't be afraid. It's really approachable, very easy. Oh, I even left one thing out that I sometimes do, and that's a laser facial. And that's a low-level laser, either with the Derma V or our Q-switch laser Spectra. The laser just goes over your skin, delivering energy. It feels warm, pain-free, zero downtime, and that is an ongoing stimulus for your skin. The reason I do that is maybe I just want something quick, easy. I'll do it on my arms. Or if you've got an event, it really helps you get that little dewy, hydrated glow before an event. I'll probably think of other things I do. Maybe I'll add them as an end note, a sub note on our YouTube channel. But thank you for listening, and we appreciate you tuning in to Queen City Skin Podcast. We so enjoy sharing what we love with you and really appreciate you listening in. Thank you.
Thanks for listening to Queen City Skin with Dr. Elizabeth Rostan and Dr. Emily McLean.
We hope you're walking away with tips and insights you can trust, and maybe a little extra confidence too.
If you enjoyed today's episode, be sure to follow or subscribe so you never miss a dose of skincare wisdom.
And if you have questions you'd like us to cover, connect with us at Charlotte Skin and Laser or find us on Instagram at Charlotte Skin and Laser.
Here's to healthy skin and feeling your best. We'll see you next time.